everyone, welcome to my channel. Today I'll be talking about urinary tract infection, commonly known as UTI. So UTI is an infection which can occur anywhere in the urinary system. It could be in the kidneys, ureter, bladder or urethra. But commonly it occurs in the lower urinary tract, that is either in the bladder or urethra. Now let's see what are the causes of it, right? So mainly it is caused by bacteria, but rarely it can also be caused by fungi or viruses. What are the risk factors to develop UTI? First one is gender. Women are at a higher risk to develop the infection because they have shorter urethra. Second one is sexual activity. Third one is use of certain contraceptive. Fourth one is menopause because there is decreased estrogen levels. Fifth one is poor hygiene. Sixth one is urinary tract abnormality or blockage in the urinary tract. Seventh one is use of catheter. Eighth one is weak immune system. Ninth one is certain health conditions such as diabetes, kidney stone or even enlarged prostate. And 10th one is previous history of UTI or even family history of UTI. So what are the symptoms of UTI, right? So it depends if the infection is in the lower tract or upper tract. So I'll be telling you both the symptoms. If the infection is in the lower urinary tract, that is either in the bladder or urethra, then the symptoms will be, first one is low grade fever. Second one is burning or pain while passing urine. Third one is cloudy, dark or very offensive urine. Fourth one is frequent urination or frequent urge to pass urine. Fifth one is pain or pressure in the lower abdomen or in the pelvic area. And sixth one is blood in the urine. Now, if the infection is in the upper urinary tract, that is especially in the kidneys, then what are the symptoms, right? So here the symptoms will be, first one is high grade fever and chills. Second one is nausea, vomiting. Third one is flank pain, that is pain or a sensation of pressure in the lower back or in the sides. Fourth one is fatigue or generalized weakness. So how do we diagnose? So commonly we go for urine analysis. Second one is urine culture, where we come to know the exact bacteria which is causing the infection. And in cases or if required, we can also go for imaging studies such as ultrasonography or CT, where there is recurrent UTI or if there is any complication, just to know if there is any underlying cause for it, right? Next is prevention. How to prevent the development of UTI? First one is stay well hydrated, because fluids or water will help to flush out the bacteria from the urinary tract. Second one is urinate frequently and empty the bladder regularly. Do not hold the urine for long time, because holding the urine for long time will allow the bacteria to multiply. Third one is practice proper hygiene. Fourth one is urinate after sexual activity, because it will help to flush out the bacteria if in case the bacteria has entered during the sexual activity. Fifth one is avoid tight fitting undergarments, because tight fitting undergarments will trap moisture, which is a very good environment for bacterial growth. Sixth one is avoid using any kind of irritant in that area. Seventh one is diet. Mainly cranberry helps to prevent sticking of bacteria to the urinary tract lining. Eighth one is avoid certain contraceptive which may lead to the development of UTI. That's all for today's video. I hope this video was useful and you got overall information about urinary tract infection. If it was helpful, then do share it with your friends and family, and do remember to subscribe to my channel and start your journey on being healthy. If you have any doubts or any questions, leave it in the comment section below. Thanks for watching. I'll see you in the next video. Until then, goodbye.